All right, so to keep going, so this is part 2 of lecture 1, and we're going to keep going on these directional terms. There's just a few others before we move on. So that brings us to deep versus superficial, okay? And this is usually referring to, we can talk about skin being superficial to muscle. Okay, so the depth of something. We can also talk about something being intermediate. Okay, so something intermediate would be the elbow is intermediate of your shoulder and your hand. So you can use intermediate as well. And then lastly, we have ipsilateral versus contralateral. Ipsilateral is referring to being on the same side of the body. And contralateral being on opposite sides or different sides. So the left arm and the left leg are ipsilateral, right? And the left arm and the right arm are contralateral. We usually use these terms in the nervous system more than anywhere else, but I'm going to introduce them now to you as well. So again, the right thumb and the right index finger are ipsilateral. All right, so it's another topic to talk about is sectional terms. So lots of times in anatomy, we have to take sections of anatomical structures. We have to take slices, and this could sometimes be hard to interpret, okay, especially when you're looking at it under the microscope. So this is a nice picture showing you what would happen if we took slices out of the small intestine. And depending on where we took these slices, the image is going to look a little bit different. All right. So again, a lot of this has to do with when we're going to look at something under the microscope. All right. And you have to always be aware of what it would have looked like if it were in its three-dimensional form. Okay. So if we look at this first image up here, and we took an exact cross-section of the intestine, we would get this nice round image here, okay? But that's not always the case. It's not always going to be a perfect world and a perfect situation where we can manipulate the organ that way when we're trying to make a section to prepare it for the microscope, okay? Because these things they can be very small. So here, if we took a section this way, the small intestine is more on an oblique angle. It's more on an angle this way, okay? So you would get an image that looks like this, okay? So we always have to think back to what the organ looked like or the orientation that it was in. All right, and here's a couple other examples here and here. So if we took this section right here, we would get this elongated view of the small intestine. Where if we took this section and it went through where the small intestine actually made a turn, you would get this section, okay? So that is why looking at histology, looking at the tissue level, can sometimes be confusing because you lose sight as to what the actual 3D structure was. So you kind of have to think about that. Again, if you took a section down here, okay, you don't get this view anymore. You get this view, all right, because of the way you sectioned through the tissue. So it is very important to consider when looking at the microscope, these microscope slides, the three-dimensional structure of it, okay? Because the views can change throughout, okay? It really just depends on where the section was taken. So sectioning matters. Where it's taken from is going to change the appearance. All right. Now we are going to look at something called anatomical planes. Anatomical. To continue this discussion about sections, we are going to talk about the three cardinal planes of the body. Sorry, my spelling and writing is not great today. All right, so the first one we're going to talk about, and I have pictures to show you what each of these look like, is called a frontal or coronal plane. All right, that is going to make a separation through the body, creating an anterior and posterior section. Let me take you to that. All right, this section right here is the frontal section or coronal. If you want to think of it as coronal, you can think of it as wearing a crown, and that would separate the front from the back. That would separate anterior versus posterior, okay? So it's oriented parallel to the long axis, and it divides anterior from posterior, all right? The next one is a sagittal plane. Let me show you. This divides the body into left and right halves. That's this one right here. This is a sagittal plane, all right? That is going to divide the body into right and left halves, all right? There is also what is called a mid-sagittal section. And so if I were to draw a stick figure, again, my drawing is not great. A mid-sagittal section is directly through the midline. All right, that wasn't perfect, and my iPad tried to make it perfect, but it's a little tilted. But a mid-sagittal passes through the midline, okay? But you can have many other sagittal sections all going down like this. The same is true for these coronal. There are many of them, infinite numbers of them that you can create. It's not just exactly at the center, if you will, because here would be the coronal, right? Here's the coronal right here. You can actually have several sections. It's really hard to kind of show you what I mean by that. But there is an infinite amount of sectioning you can do here. There is an infinite amount of sectioning you can do here. And then third, we have what's called a transverse or horizontal section. This is also, I commonly say, a cross section. Here is the cross section. So we're cutting through the body to create a transverse plane, okay? So again, here is the sagittal. Mid-sagittal would make a section into left and right body parts. Here is a frontal where you're taking off the anterior portion of the body. And here is the transverse section, okay? Those are the three sections anatomical planes that you can make throughout the body. I've included an additional slide here that says and shows you everything I already went over, but shows it to you all in one, just in case you're a visual learner. I oftentimes put additional slides, not for the purpose to increase things for you to memorize, but to perhaps show it to you in a different way. Okay, so this is highlighting, here is the coronal plane, here is the sagittal plane, and here is a transverse plane. These are also additional slides, again, not to give you more work, but what I liked about these is when we were talking about those directional terms and I was giving you examples, these next slides give you all examples of each on the right hand side in case you happen to need it. If you need a better explanation for any of the terms that I went over, okay, here's medial and lateral again. I lost my pen. Intermediate, there's proximal and distal here. Again, if you need it, I'm going to upload these additional slides for you to work through if you are having trouble with the directional terms. The last topic that we are going to cover is body cavities, okay, or coelums. It's another term for body cavities. All right, this again will be the last topic for lecture 1. All right, so many organs within the interior portion of the body are suspended in closed, fluid-filled chambers called body cavities, okay? And I want to explain to you some of these body cavities, all right? And they contain many important organs, all right? So we have the lungs, our heart, the digestive, urinary, and reproductive systems are also contained in cavities. And these cavities are lined by something called serous membranes. Okay, so let me show you what that looks like. And the reason for this is that we have organs that have a lot of movement to them, okay, or they may change in size. And what happens is when organs move is that friction can occur. And so these membranes are designed to help reduce friction. I think I have that on another slide, but I'm going to write it here just in case. All right, so let's look at these body cavities and what they are, okay? So on this slide, we have 2 different body cavities. We have something called the dorsal body cavity and the ventral body cavity. All right, the dorsal body cavity contains the cranial cavity, which houses our brain, and the vertebral cavity, which houses the spinal cord. All right, these cavities are surrounded by bone. All right, so we're going to take some time and talk more about the ventral body cavities, okay? And so just as an introduction, and then we'll get more specific, there is a thoracic cavity. This is going to contain the heart and the lungs. And then we have an abdominal cavity. These 2 cavities are separated by the diaphragm, okay? There is a physical separation between the thoracic cavity and the abdominal cavity. And again, we talked about the fact that the abdominal cavity contains a lot of the digestive organs. And then we have the pelvic cavity. where the bladder and reproductive organs, as well as the rectum, are located. This is a lateral view. Let's take another look at these abdominal and thoracic cavities. All right, so again, if we're looking here, all right, you can see the thoracic cavity here contains the lungs and the heart. All right, so let's take a closer look right here. All right, so what this is showing you is that each lung sits in the thoracic cavity inside of another cavity. So this is kind of like, you know, those wooden Russian dolls where you have one doll, you open it up, and there's another doll inside, and then you open it up, and then there's another doll inside. This is kind of like that. They're cavities within cavities within cavities, okay? So just bear with me. Within the thoracic cavity, there is the pleural cavity. And within the pleural cavity lies the right lung and the left lung, okay? So again, the lungs sit in the pleural cavity, which also sits in the thoracic cavity, all right? And I'm going to come back to this idea that they are surrounded by a membrane called a pleura. All right, then within the thoracic cavity is another cavity called the mediastinum. The mediastinum houses another cavity called the pericardial cavity, okay? The pericardial cavity houses the heart, okay? So you could do sort of a flow chart, if you will, starting with the thoracic cavity, breaking it down into the pleural cavity, which houses the lungs. And then I don't have a lot of room, but you can go over here to the mediastinum. And within the mediastinum is the pericardial cavity. And I'm going to run out of room here. Okay, sorry, that was kind of disastrous. Okay, so the mediastinum, just to outline this, it's all here in yellow. Okay, so I think this brings us to a good point that writing flowcharts is really important for organizing and understanding your thoughts. I know mine was not great. I probably should have included like a blank piece of paper here. But be sure to write this out. Use your textbook to help you understand the cavities and the cavities within cavities, and then what organs are in those cavities, okay? I want to move next to the abdominopelvic. Sorry, I lost my pen. Cavity here, okay? I think before I do that, so the good thing is the abdominopelvic cavity is not, there's not like cavities and cavities like there are in the thoracic cavity. It is just going to house some of the abdominal or some of the digestive organs. However, there is going to be something interesting that comes up, that there are some organs, and I'm going to talk about this later, I actually don't really need you to know it right now, that are going to sit outside of the cavity, okay? And they are called retroperitoneal, okay? We're going to come back to that. Let's just stay focused on these cavities and what they're called. So let's talk about the names of the membranes that surround these organs and cavities, okay? So we have these, there are 3 cavities that have a specific, they're more of a specific type. They're called serous cavities, okay? And again, there's 3 of them that have these particular membranes associated with them, okay? So the lungs, the heart, and the abdomen are all very specific types of cavities called serous cavities. All right, so what happens is when the lung or when the heart is developing, it kind of starts as a bud and it pushes down into these 2 membranes right here. Okay, and by doing that, it creates a double-sided membrane with fluid inside of it. Okay, so imagine the heart pushing down as it develops into this cavity, and it has 2 sheets of membranes. All right, so it's kind of like if you blew up a balloon and kind of put your fist gently into the balloon, you would then create these 2 membranes right here, okay? And so these membranes are called serous membranes, and within the middle is serous fluid, all right? So there is a specific name for the membranes that surround the heart, and they are called the pericardial sac. So it's the pericardial sac or membrane that surrounds the heart. It is a serous membrane. All right, it surrounds the heart. And again, because the heart is beating and moving and friction can occur, these membranes lubricate the organ for while it is beating, so that friction is reduced. Okay, so the pericardium is the lining. Okay, it is the membrane around it, and then the heart sits in the pericardial cavity. Okay, and again, this is to ensure that as this heart is beating and moving, friction doesn't build up, because again, you have these membranes around it to reduce or prevent friction. All right. The lungs sit in the pleural cavity. Okay, that surrounds the lungs. The lungs are moving and expanding as we take in air as we are breathing. So this pleural serous cavity helps to prevent friction for when the lungs move. We also have, a peritoneal serous cavity, and this is what is surrounding the peritoneum. Is another term for the abdominal cavity. Okay, this is where most of the digestive organs are. There's some accessory organs there, and this is to help when the intestines are always moving during digestion. So again, we want to reduce friction. All right, so and I've touched on this, but I felt like it would be better to write it out. So again, there are those 3 cavities that are lined with a serous membrane, okay? And the membranes actually have names to them, okay? So the one membrane that lines the internal surface of the body wall is the parietal layer. And then the membrane that actually covers the organ, the specific organ, is called the visceral layer. So please make sure that you understand the difference between the two. I think I have a better picture here. So again, if we are looking at the serous membrane that is covering the lungs, okay, this is called the pleura. That is the specific membrane surrounding the lungs. We have what's called a visceral pleura. That is the membrane closest to the organ. And we have a parietal pleura. That is the membrane further away. And in between the two, we have serous fluid. Okay? And again, these specific types of membranes, these serous membranes, line the heart, line the lung, and line the abdomen. Another term for abdomen is the peritoneum. This slide is again highlighting the importance so that you understand that each of those membranes has a name. Visceral being closest to the organ, parietal being further away. In between, there is serous fluid. These are, again, the names just to kind of drive home this concept for you that we have serous membranes in 3 specific examples that I want you to know. All right, we just went over the membrane, the serous membrane that surrounds the lung is called the pleura. The serous membrane that surrounds the heart is called the pericardium. And the serous membrane that lines the abdominal cavity is called the peritoneum. Okay, this is what how thin it is. It kind of looks like saran wrap. I kind of think of it like 2 pieces of saran wrap coming together. Okay, so take a look at these slides, work through them, work through each of these topics, and begin to understand all that is involved in Lecture 1.